We are in beautiful downtown San Francisco at the Advanced Hands-On TMS Symposium. This conference brings together some of the leading figures in the field of TMS. This faculty brings together almost 100 years of combined clinical and research experience in the field of TMS. Conference attendees have the opportunity to learn at the feet of the pioneers in the field.
So I've been working with TMS for 26 years, so I was the first to do TMS and depression. And so I've been watching the technology grow, through early science to FDA approval and then now to market rollout, and watch the field grow in terms of who actually delivers TMS. And there is a massive need in terms of untreated or undertreated patients with depression.
Well, TMS is transforming the practice of psychiatry, and it's transforming the treatment of depression. TMS is the first safe, non-invasive, office-based brain stimulation, neuromodulation treatment in the history of medicine.
It's great to see sort of clinicians really here, kind of eager to learn, eager to see how can I incorporate this into my practice, and really ask very good penetrating questions as well. We could sometimes miss the very real clinical aspect of what we're doing, and so to have sort of active, smart clinicians sort of say, well, what about this? What about this type of patient? What about this situation? What would you do here? It's sort of fun and invigorating for us in terms of where we say, well, we need to research that. We need to develop studies in that area.
I want to learn about TMS because I'm planning to open a practice in Hong Kong using TMS. We get to learn a lot from different experts in TMS all over the country, and then we get to see some machines that are now approved by the FDA for using TMS, and we actually get to learn each machine quite in depth, and we get to learn how to actually properly administer TMS for patients, which are very important, I think, to see it in practical terms.
This has been very educational. My confidence level has improved greatly. I feel confident enough to actually carry out treatment and prescribe for patients.
This weekend was amazing. I had learned a little bit about TMS out in the psychiatric world where I work in San Diego, but coming to this program this weekend opened my eyes to not only the present use of TMS in treating patients, but also what the future is going to bring. It's very exciting.